Hello friends, welcome to the webinar. Today I'm going to deal with the COVID-19 pandemic and its multidimensional impact with this presentation. I'm Dr. Maithili Hazarika, an Associate Professor of Clinical Psychology, Department of Psychiatry, Guwahati Medical College Hospital, and I'm involved in a lot of organizations from the state. The discussions generated during the presentations are academic in nature. They are not laws or any substitutes for professional or legal opinion. You can contact a lawyer or an advocate for any kind of legal opinion. Now, COVID-19 outbreak, what is it? It is declared as a pandemic by WHO, that is the World Health Organization, on 11th March 2020. Over 1 million people are infected, and there are more than 1 lakh people who are infected, but in India, there are 10,558 positive cases on 14th of April, and the death toll had risen to 356. Case fatality rate is 3.5%, and there are subclinical infections which are not tested. So after the recovery also, deaths may appear. China, Spain, Italy, and the USA are the most affected countries. Following a pandemic, there is a profound and broad spectrum of psychological impact that can be inflicted on people. At the individual level, it can precipitate new psychiatric symptoms in people without mental illness. It can aggravate the condition of those who had pre-existing mental illness, and it can cause distress to the caregivers of a fatal individual, including the healthcare workers. People may experience fear and anxiety of falling sick, or be helpless, or blame others who are ill for potentially triggering a mental breakdown regardless of the exposure. Psychiatric morbidity have been found to be very present, from depression, anxiety, panic, somatic symptoms, and there could be post-traumatic stress disorder. There could be delirium, psychosis, that is not in touch with reality. They could hallucinate, they could have different kind of delusions, and even suicide, which have been associated with younger age, and increased self-blame could also be there. There could be anger and resentment issues for the people who have lost their family members because there was no closure. And people who are sick and quarantined may experience a lot of guilt, and they could be stigmatized by their society. So longer duration of quarantine is associated with increased prevalence of post-traumatic stress disorder and depression, which is based on earlier research work. Is distress universal? Yes, distress is universal because it is based on uncertainty. Fear of dying and death is very prominent. This kind of an event is unprepared. We were not prepared for this. It is very sudden, which has never happened before. Lack of adequate knowledge. We do not know the manner of transmission. Do we know to a certain extent about the transmission through droplets, through air, through contact with the COVID-19 people? But there are a lot of researchers' work is going on to have an adequate knowledge about the transmission process, about the disease process. We people are non-adaptable and non-flexible people. The sudden change in our routine makes us very, very anxious. And there could be guilt issues, like certain things we have not done in the past. As a profession, we had not chosen the right profession. So these could be different kind of guilt in us, which may lead to some kind of existential anxiety, like life is non-meaningful. It is better to die, and what is this life? And these kind of different kind of anxious thoughts are percolating. And on the top of this issue is that there is no treatment for COVID-19 yet. So the anxiety is very, very high, because if there is no treatment, the cure also becomes very, very difficult. And social isolation and distancing are the only weapons to cure oneself. Pandemic causes panic. So though it is a normal reaction to an abnormal situation, the panic, the anxiety, the fear among the general population may lead to a crisis, and that crisis may lead to breakdowns in people. We have to minimize the media exposure and seek information from trusted and authenticated sources, because finding opportunities to amplify positive and hopeful stories is very important. So we have to know about the cases of recovery rather than the cases of loss. We need to stay connected to people, to family members on a daily basis through social networking. There could be uncertainty, so unorganized our lives are becoming. We should keep regular routines, schedule our days well, keep ourselves busy in different kind of activities like relaxation, yoga, prayer, dance, singing, and keep a regular social routine, when to call whom and what kind of agenda to be taken. If we are people who go to the office, we have to do our office work in a room away from our bedrooms in a very, very formal and a structured manner. And we should eat healthy food and keep our immune system intact. We should build up our resilience. So pre-existing mental illness, that is the 10% of the population who had mental illness, will relapse due to the extreme stress. So there could be non-availability of medication, and the stopping of medication may give rise to a lot of mental illness. So telemedicine has been started. So we should start taking help of telemedicine, that is medicine over the telephone. People with substance abuse may have a lot of problem because of non-availability of alcohol, tobacco, drugs during lockdown. So it can cause withdrawal and other health issues. So they need sometimes emergency help. Before you go to any hospital, we have to know and take telemedicine consultation for any of our issues, and call our family doctor and doctor friends. We should not medicate ourselves without any prescription and consultation. We should not use any kind of drugs and alcohol during distress. Post-pandemic mental health issues are also very serious. There is a high possibility of having mental health problems in the form of depression, post-trauma, increased use of alcohol because of isolation that we had experienced, because of the quarantine, because of the stigma and discrimination towards us when we were quarantined or when we were in isolation. Violence and grief and financial problems could elicit a lot of different kind of mental health problems. So we need to empathize a lot with the healthcare workers because they are the frontline workers and they are stigmatized more. A lot of people had even declined to accept them as tenants anymore. So these are certain issues that has to be dealt very sensitively, and healthcare workers needs a lot of encouragement and motivation during this stress. So we need to empathize with them. At the community level, there could be distrust among each other. With the closure of community services negatively impacting the economy, many people end up with financial loss, further intensifying the negative emotions like hatred, anger, and hostility. Internationally, we have seen that stigma and blaming other communities, and there could be a lot of communal unrest. We should keep ourselves away from all these and not have any kind of discussions on religious issues and communal issues. There's increased rumination of contacting the disease because internationally a lot of countries have failed in controlling this disease. So we also feel panicked at times, thinking that our country also is going into the same direction, or we may have COVID as soon as the other people are having through community transmission. So this can profoundly remodel people's behavior and social interaction. Feeling of helplessness when in anxiety can often motivate people to use unproven methods and remedies that may be detrimental, like suicide and substance abuse. So the need for the hour is that most of the countries have focused on controlling the disease curve with much lower attention on mental health. But research suggests that mental health issues are very, very significant. So a multidisciplinary mental health scheme is necessary to curb down the consequences of the pandemic and to deal with the process of recovery. Teams should comprise of psychiatrists, clinical psychologists, psychiatric social worker, and counselor, and it ranges from psychiatric clinics in all hospitals, private psychiatry, psychotherapy clinics, friendly counseling centers, and telecounseling. This is a standard structured operating procedure which we have started in Guwahati Medical College and Hospital. This should be read by everybody, and also other guidelines that are provided by the healthcare professionals to know about the COVID-19 disease causes, transmission, and what are the different protective equipments and process that we have to undergo, and also educate the people in need. Thank you very much.